So, very good evening. And basically, as I said, we'll be talking about the National Action Plan, which is being implemented in India for prevention and control of snake bites. So, basically, I'm from Ministry of Health, where we have institute called as National Center for Disease Control, which looks after the implementation of different national health programs. And one of the program is National Program for Prevention and Control of Snake Bites. Uh, As we all know, the world is burdened with snakebite mortality, morbidity, and disability, and half of the global burden, as estimated, is bear by India. And if India succeeds in this national action plan, we will be achieving the goal of reducing the global mortality by half by year 2030, and that is what the objective of our national action plan is. So this is our institute from where we implement this action plan. And our institute is, we have a division called as Center for One Health. So we look the problem of snakes as not only as a medical management, but from One Health perspectives. That is means not only about the clinical management, but also the preservation and conservation of snakes in coordination with the Ministry of Animal Husbandry and Ministry of Wildlife and Forest Division. So just to give a glimpse of before I explain what we are undertaking for snakebite prevention and control, the critical point is to find out where these cases and deaths are occurring. If you see the map on the right side from year 2021 to 23, these are the cases and these are the deaths in different parts of the districts. So what is important to understand is that if we really want to reduce the number of cases and deaths, we need to find out the high risk regions. So we start from districts and go below that, sub districts and villages, the field level areas where snake bites are more common, and then target the interventions to those high risk areas. So there are few states. So although it has been estimated that there are almost 58,000 deaths in India, recent ICMR study, which was presented in Toxicon, I think they estimated 40,000 deaths per year. But what we get reported only 3,000 to 4,000 deaths. So there is a lot of work to be needs to be done under the surveillance program. So what we are undertaking for this is that we are developed this real time the digitalized system called as integrated health information platform. I will show you how this reporting is done, but just want to show you that how the states, India is vast states and vast country, and each state like any other country for in if we compare to the global. So if you see that different states, so this is like Maharashtra from Western Ghat region. If you see the areas related to the Western Ghat where high forest area, agricultural land, heavy waterfall, they have high number of cases. So the, there are some districts which report maximum number of cases. Similarly, this is from the eastern part, from Odisha. The Cuttack is one of the district which has high number of cases and deaths. Same is true for the Tamil Nadu. A few representatives are from there. This also has high number of cases, but there are few districts which are, and among those districts, there are few blocks or villages which are responsible for more number of cases and deaths. And this is one of the highest reporting state, that is West Bengal. So the take home message is basically we want to find out the areas where these hotspots are and target our intervention is. So this is our integrated health information platform system. So this has started since last 2 years, and it has been expanded to all of the country. If you see the the data is entered on snake bites, all the details of that particular case. So at national level, the state level, we can have the data on where that person, and it is GIS enabled, so we can tag that person. So this is the data from, I think, last month, 2000, so this August. And if you can see, these are the cases and deaths, and along with their representation, we can find out which are high risk population, and we can also locate it through GIS map. So this is a the first state of art digitalized system in the whole world for the case based reporting. If you see the seasonality, the classical rise is in the monsoon season, because India has different three seasons in that, because of the the habitats of the snakes is filled up with water, and there are increased snakes and human encounters, which classically represents like any monsoon related disease. So what is important is that we conduct the trainings and uh, intensify our prevention measures before the monsoon season. So this is a classical picture where more of the males, the individuals which are outgoing, especially in the agricultural and farmer workers, they are more prone for snake bites cases and as well as in the deaths. But the problem is that since they are the only wage earners, that puts the family in the jeopardy because it has both social and economic implications. So globally, WHO and these snakebite initiatives, they had this action plan that to reduce the number of deaths and disabilities by 2030. So we wanted some document based on which individual states will frame their own action plan, and that's why this national action plan was devised. But if something has to be implemented in a whole country like India, it needs not only the Ministry of Health but all the responsible ministries like Ministry of Environment, Forest, Ministry of Agriculture and Farmer Welfare. So all those stakeholders will were taken into account. Even the drug general CDSO, regulatory authorities, and obviously the most important part NGOs and private partners. So all those were taken into the account, and we developed this national action plan based on the WHO's regional action plan recommendation. And we had a first meeting in July in 2022, and after that we constituted a core committee which drafted this action plan. We had also meeting with all the manufacturers because their viewpoint is most important. Yeah, and they are the suppliers not only for India but many of the countries in South Asia and Africa. Importance was about the prevention of snake bites is very important. So we had meeting with the communication officers, NGOs, all those prominent NGOs which are working in India for snake bite. We had meeting with them on what strategies should be adopted in the national action plan. Those were included, and the clinical experts, few of them are here. We the important point was to develop a algorithm, a protocol for management of snake bites. India has almost more than 215 species, more than 15 medically important snakes. So what was important that we devise a protocol which will be applicable to every state. So in that protocol, we devised that each snakebite victim should receive at least 10 dose of vials before he is referred to the higher center. And this was the interministerial meeting, and this was launched in 12th of March 2024. But today's presentation is about after the launch, what were the challenges for us and how we are managing through it. So these are the standard treatment guidelines. It have been issued to the most of the all the PSCs, and also the funds have been given to all the states. So each states can now procure free anti-snake venom for all the snake bite victims. And for educational videos, we have prepared pamphlets, the posters, radio jingles, so that they can catch the audience of the field level personals. The most important part is the snake bite helpline. If some person in emergency gets snake bite, he can call this helpline number. If this is launched in a few states, 5 states we have piloted, and it will be expanded to all of the for the country, so that they can know where they can reach in that emergency. So this is a protocol I was talking about. This has been disseminated all over the country, and this talks about how to manage a snake bites. The key point is each victim receives 10 dose of anti-snake vial, that is polyvalent snake venom. Another part is that we are also making this snake bite notification as compulsory. So it has to be made as notifiable disease. The notifiable disease means if some disease is made notifiable, it is compulsory for any private or public practitioner, even the traditional healer, to make it notifiable so that the appropriate attention is given. So it will be made notifiable. Few states like Karnataka, they are made already notifiable. The important point which is responsible for deaths in India is that the medical practitioner or the medical officer who is a fresh graduate, once the victim comes, he doesn't feel confident enough to administer the anti-snake venom. So that was the critical need of the training. So we are undertaking a trainings across India for that purpose. There is another component of the legal environment. So in India, traditionally there is a law that if you catch a snake for milking, it has to be released back again to its own place. And it was suggested to us that if you, since it is being carried out since many years, it was suggested by the global authorities, that even by WHO, that you should allow the snakes in captivity for venom collection, because it increases the quality and yield. So we had a legal consultation, and accordingly Ministry of Environment has agreed for that. We will be shortly issuing an advisory in that regards to improve the quality of anti-venom for that purpose. The most important point is that if any death is reported, we should find out what is exactly the reason behind it, and then take the actions accordingly. So we have developed this form called as snakebite death investigation form. It is very detailed form. So if we get any Google alert from any of the newspaper, local or national newspaper, we immediately mail to that traditional that form to that particular nodal officer, and he has to investigate and take that action. So it has resulted in the sensitivity of the medical officers towards the snake bite victims. These were the training gaps, as I have mentioned. They were not feeling confident enough to administer anti-snake venom, and they were not having a standardized protocol. Another important part is that the medical curriculum at present, which is there in India about the snake bite management, it doesn't have proper emphasis on snake bite management. So that we are also working on. So in this last 5 months, we have almost visited 14 states. So you can see the program, and we are giving the physical trainings to the all the snake bites, the medical officers which are actually on the field. So we call them and train them with our clinical experts and the herpetologists. So if we and we also do the pre-testing and post-testing to check their effectiveness. And after that, we use social media. We join them on a social media group, so their WhatsApp groups are created, and if they need any support, immediately that support is given. So this is how the we want to improve the clinical management of those snake bite victims which are attending the lowest level of health facilities. If we see, the training is part in most part of the country in these last 5 months. Remaining 5 months we will be covering the rest of the country, and by this pre-test and post-test, we could see almost 70% improvement in their knowledge about the clinical managements of snake bites. So this is actually the outcome of our training, that most of them now feel confident enough. But what is important is that when the actual snake bite victims comes, they should give that particular anti-snake venom. Now the part comes that the states, once national action plan is developed, the states should develop their own state action plan, and for that they need to involve not only the health department, but as I said, wildlife department, because most of the victims also reside in forest areas. So wildlife sector is very important, along with the tribal areas, because they have the increased contact with snake bites encounters, and obviously the NGOs. So the critical part is that we map those health facilities which are there in those areas, high risk areas where snakebite encounters are maximum, and ensure the robust surveillance through our IHAP platform. So this is how we are mapping those facilities where anti-snake venom is available. Rather, we have said that at every primary health center is the one which is at the lowest level of health facility, and we have made this anti-snake venom available in these health facilities. And for each clinic complicated case, they had to report to a district hospital. And this this is our short term plan. So for each year for till 2030, to reduce the deaths by half, we have created some action points. And first is the regional venom centers. Basically, the India currently has a polyvalent antivenom center which which targets the four snakes: the cobra, the common crate, saw scale viper, and the Russell's viper. But India has some range restricted species like northeastern states where the green pit vipers, then the hump node pit vipers, monoclade cobra, these are common. So for those range restricted species, we are going to have regional Venom centers in each region of the country where they will be pulling and milking the snakes from that particular region, and that will be provided to the manufacturer for providing preparing the antivenom. And obviously we will be make this snake bite as a notifiable disease. In 2016 26 to 27 we are mainly have poison information centers. At present we have 12 poison information centers, but only two of them are from medical colleges, medicines center, but rest are forensic medicine. So we want to have a poison information center in each state where the clinician will guide those medical officer on how to treat that particular victim. So that will be setting up in this next 2 years. And the digitalization, although surveillance has been digitalized, we want to add the anti-snake venom availability shortage data on the digitalized platform. So we are working with that particular app and the website for that. And long term, obviously the most neglected part is about the disability. So that will be undertaking through the sentinel sites, because at present the focus is on morbidity and mortality, but the disability and psychosocial part, that is important, that will be undertaken through the sentinel sites, which will be the medical colleges which will be undertaking this. And lastly, the legislation part, which for the medico legal areas, and the research modalities mainly for the dose finding studies, because at present we are providing almost 20 average 15 vials per particular one patient. So we want to find out the exact dose to be given of that current pollen antivenom to the each snake bite victim. So these are the two critical gaps we also had discussed in toxicon in India. That first is the okay, so first is the improving the quality of current polyvalent antivenom. So as I mentioned, we are going to use it through regional venom center, and those as you know, it is mainly collected through the EULA society located in Tamil Nadu. So we will be giving them training, as well as they will be made mandatory to provide the certificate of analysis. And secondly, another part is the antivenom for the range restricted species. So for that, we will be having a separate antivenom for northeast region. Apart from that, there is another part for the tour ambulance and pre-hospital care. So this training personnel, this is a 102 ambulance. So we are going to carry out the training of those persons so that they know how to transport the victim to the health facilities. And lastly, the each person should know how to prevent a snake bite. So snakes are actually worshipped in India, so they are taken care of, but they should also know how to prevent the snake bites. So we are going to launch this massive IEC campaign. We have provided funds to the states for the same purpose. And lastly, obviously, the operational research, those finding studies are the critical part we will be undertaking through our program. So this is actually the way forward. We are now going to have a central sector scheme. That means we could provide the funds to all the institutions, the health institutions, wildlife institutions, for undertaking the prevention and control activities in snake bites as well as the research. So that we'll be providing. Secondly is the digitalization of anti-snake venom. So we could see from the at national level and state level where is the AS anti-snake venom available, where is the shortage. So all these thing can be done in on a like we had a COVID vaccine, same portal will be using for that particular. We'll be extending the snake bite helpline to all the states so that every snake bite victim knows where he can go, and so that and he also gets mapped to address the effectiveness of current pollen antivenom. Will be issuing the guidelines so that the quality of current pollen antivenom improves, and then it is delivered to all the snake bite victims. And lastly, as Dr. Shakti said, they are organizing a conference, and a lot of conferences are being organized we also have a conference, and you are welcome for this conference. This is a central research institute at Kasoli, which prepares both anti-rabies serum and anti-snake venom. So this conference will be basically targeting the hyperimmune sera production. If anybody is working in this area, you are very welcome to join this. This is a Kasoli located in Himachal Pradesh, a very beautiful town. It is from 8 to 10 September. The idea is to basically discuss the ways how we can undertake a research in India for snake bites and the polyvalent anti-snake venom. So these will be deliberated in this conference. And this is our team from Center for One Health, where we undertake these activities, which not only targets the medical management but whole of One Health aspect of not only the snakes but all animal bites, the zoonosis, and the emerging diseases like Nipah, Zika, COVID, all analog within recent in news, that is monkeypox. So that's all. Thank you.